Human Metapneumovirus outbreak in China. What you need to know about this China virus trend. Hey everyone, welcome back to Moha's Health Hub. In today's video, we'll discuss an increasingly important topic that's grabbing global attention, the Human Metapneumovirus outbreak in China. We'll explore what this virus is, why it's a concern, who it affects, and most importantly, how you can stay safe. If you're a health-conscious individual, this video is for you. So let's dive into everything you need to know about HMPV. Let's start with the basics. What is Human Metapneumovirus, or HMPV? This respiratory virus is part of the same family as influenza and RSV, but it specifically targets the airways, causing symptoms like coughing, fever, congestion, throat irritation, and a runny nose. For most healthy individuals, these symptoms tend to be mild and manageable, resembling a common cold. HMPV becomes more than a minor inconvenience when it affects vulnerable groups. It can develop into severe complications such as bronchitis, pneumonia, or even life-threatening respiratory distress. This is particularly concerning for young children, the elderly, and individuals with compromised immune systems. Since we still don't have a specific vaccine or antiviral treatment for HMPV, raising awareness is key to early prevention. Now let's shift to what's happening in China. Northern provinces have been struck by a worrying surge of HMPV cases over the past few months. Hospitals are becoming overwhelmed with patients, particularly children under the age of 14. The increasing number of hospital admissions is drawing comparisons to the early days of the COVID-19 pandemic, although medical authorities emphasize that the situations are not identical. As of late December 2024, health officials in China report ongoing efforts to closely monitor this outbreak. Local health departments are working to contain the spread and mitigate the impact on vulnerable groups. The concern isn't just geographical. Neighboring countries like India have also reported HMPV cases, raising regional alerts for potential clusters. The primary focus right now is on creating public awareness and ensuring early diagnoses to reduce the burden on healthcare systems. If numbers continue to climb, it could strain medical resources, impacting treatment availability for other conditions. While human metapneumovirus often leads to just mild symptoms for the majority of people, understanding who's most at risk helps us prepare better. The groups most vulnerable to severe complications include young children. Their underdeveloped immune systems make them particularly susceptible to respiratory illnesses. The elderly, as age weakens immunity, severe effects such as pneumonia become more likely. Immunocompromised individuals. This includes people undergoing chemotherapy, those living with autoimmune conditions, or transplant recipients. If someone in your household falls into one of these categories, awareness and early preventive measures cannot be stressed enough. Complications from HMPV may appear as severe respiratory illnesses, similar to pneumonia or bronchitis. This prompts hospital visits for oxygen support and close monitoring. For health-conscious individuals, knowing when to seek medical advice is crucial to avoiding complications. Now let's discuss what you can do to protect yourself and your loved ones. Whether it's HMPV or any other respiratory virus, prevention is always better than cure. Here are some practical health-focused tips to reduce your risk of infection. Wash your hands regularly. Use soap and water or an alcohol-based hand sanitizer for at least 20 seconds. This is one of the simplest yet most effective ways to break the chain of virus transmission. Cover your mouth and nose when coughing or sneezing. Use a tissue or your elbow to reduce exposure to others. Dispose of tissues responsibly. Wear a mask in crowded or high-risk areas, especially if an outbreak is ongoing near you. Masks are more than just protection. They're a preventive step to show care. Maintain proper hygiene. Frequently sanitize commonly used surfaces like tabletops, doorknobs, and phones. Stay home and rest when feeling sick. Avoid the temptation to push through illness. Not only does rest help recovery, but staying home prevents spreading the infection to others. Additionally, staying physically active, eating a nutrient-rich diet, and getting enough sleep significantly enhance your body's natural defenses. These habits build a strong immune foundation, protecting you against HMPV and other illnesses. Finally, if you're experiencing prolonged symptoms like difficulty breathing, persistent fever, or fatigue, consult a healthcare professional immediately. Timely care prevents minor issues from escalating into severe conditions. Global health awareness isn't just a topic for doctors. It's for everyone. Learning about HMPV and sharing this information with friends and family ensures that fewer people are caught off guard by emerging outbreaks. While this situation in China is concerning, it's an opportunity for all of us to become proactive about our health. As a community, staying informed makes a difference. Remember, staying vigilant and embracing healthy habits is essential, especially in the interconnected world we live in. Viruses travel, but so can knowledge and cooperation. In summary, the Human Metapneumovirus outbreak in China highlights the importance of health awareness and collective precaution. Although experts are confident that the risk of a global pandemic is low, staying informed and prepared is our best defense. Remember, whether it's through frequent hand washing, wearing a mask, or simply educating yourself and others, every small action contributes to a healthier community.